Not-for-profit community clinics have been a fundamental part of California's healthcare safety net for over 40 years, literally catching the state's most medically vulnerable populations. Community clinics share a common mission to serve everyone who walks through their doors, regardless of their ability to pay, and in many California counties, they are fundamental in providing a significant portion of comprehensive primary care services to those who are underserved or uninsured. The governor's proposed reductions in his May 09-10 revision are unquestionably the most serious threat the state's healthcare system has ever seen. For community clinics, their very lifeblood is at risk.
This is Tom, Broke Budget. How do you feel today about the governor's proposed budget cuts?
Governor Schwarzenegger has a very large bias towards enforcement and law enforcement. He is committing significant resources to things such as corrections, $88.3 million in additional corrections for anticipated price increases, not even known price increases, $71.4 million for new judgeships that aren't even enacted in legislation yet. $3.3 million from the general fund and $2.5 million from special funds for Board of Equalization enforcement activities, and to continue to fund 500 additional positions that have been added in the last few years. $4.4 million to the Franchise Tax Board for enforcement on business tax returns and state income tax returns. In addition, $34.9 million for 240 new California Highway Patrol officers and $3 million for 14 new fish and game wardens, all while he is cutting needed health care dollars from our population.
Good afternoon, this is Tom, Broke Budget, traveling Northern California, rural Northern California, on the proposed budget cuts from the governor.
Yeah, my family and I utilize the Healthy Families benefits that the state has for us because we're a single income family right now, and without the preventative health care that it offers my children for their regular well-child checkups and their vaccinations and dental visits, I'm not sure how we would afford their health care.
I've been a single mom, and I was able to have Medi-Cal, and they helped me all through the time of having children. And then when I was able to get a job, I put my kids on Healthy Families, and they were very good about helping me keep all my kids up on immunizations. And I'm very thankful for that.
I'll be back.
The Terminator, terminate Healthy Families. No more Healthy Families. Terminated.
Oh no, what am I going to do? I'm going to have to take my kids to the emergency room instead of our nice doctor.
EAPC is a program that helps me with my health care. Without it, I have to choose food or my health care, and I don't know what I'd do without it.
I am the Terminator, and I must terminate the EAPC program.
Oh no, what am I going to do? Do I have to go to the emergency room?
For us, the golden years are supposed to be the best years of your life. What we're discovering that when it comes to medical, that if we didn't have the sliding scale, we couldn't afford it at all. They say go to the hospitals. We definitely can't afford that. So we appreciate these programs. We need them.
Having a clinic nearby in this rural environment is mandatory for me. I couldn't live without it. If the governor takes all of the benefits that I can attain here away, or any of them for that matter, I could be in a lot of trouble. And far too far from 911. It's 70 miles to the hospital, and I sure can't make it this way. So, give us a shot, please, Governor.
Without Medi-Cal, we wouldn't have a home.
Please hear our pleas. It's important that Medi-Cal be maintained for all of our health and income. Thank you.
I just want to talk a little bit about the devastating cuts that we're experiencing. This is the 8th year of cuts that community clinics have experienced. Over the last 7 years, the cuts have cut off all of the services that weren't absolutely mandatory delivered by community health centers are cutting to the bone, and actually through the bone in some cases. We are not providing services that aren't mandatory. So if it isn't the community health center that provides the services that we have available, those folks will end up in a different environment, whether that's an emergency room or some kind of a hospital treatment, which is significantly more expensive. I'm very, very concerned about the cuts, because for most community health centers, they were right on the edge of being able to keep their doors open anyway with what we've experienced over the past few years. This will push many access points into not being able to provide care at all. So it isn't just about eliminating something like adult dental or senior care or care for children. It's about having access to health care at all in rural areas. I am very, very concerned that the investment that we made over 40 years in bringing healthcare access to the most isolated parts of our rural state are going to be lost in this. And this is the kind of thing that once you lose it, it's very hard to get it back. It is not the easiest thing in the world to recruit people to remote rural areas in the first place. And once you have them, those are all people who chose to work in a rural area. If their experience includes not being able to get paid and not being able to make their mortgage or take care of their personal needs, they will move to other places where there are real shortages in healthcare, and the end result will be that the chances of them returning to a remote rural site hover a little below zero. So this is the most devastating thing I've experienced. I'm very concerned. We need to remember that community health centers are 80% personnel and 20% fixed overhead costs that we can't really have much control over. They often include our mortgages and the alike. So that when you talk about cutting a community health center, 80 cents out of every dollar you cut means staff. And staff means services, and that means lack of access, and at some point you get to the point of diminishing return and you're not able to keep any of it going. So I think that's where we're at. I think it's extremely scary. I think it is a very, very expensive way to do problem shifting and thinking you're going to save money in the long run.
It's the governor. He's calling now.